Thank you, everyone, for joining today's COVID Town Hall with Dr. Anthony Fauci, who's the Senior Advisor to President Joe Biden and the Director of the National Institute of Allergy and Infectious Diseases at the NIH. My name is Mark Perrone. I'm the International President of the United Food and Commercial Workers, also known as the UFCW. Our union family includes over 1 million essential and frontline workers in grocery stores, meat packing, food processing, retail, pharmacies, healthcare, and senior care facilities. Since this pandemic began, countless of our members, essential workers, they've been exposed, they've been infected, and sadly, many have died. In fact, a recent study showed that essential workers face a 55% higher risk than non-essential workers of catching COVID. Vaccine access for essential workers is absolutely critical given the daily hazards that they face. Yet over 35 states are failing to prioritize vaccine access for essential food workers in grocery stores and packing plants, even as they continue to face greater health risk. We are confident and hopeful that President Biden and Dr. Fauci will help ensure that vaccine access is expanded to more essential workers. As a part of our commitment to help improve vaccine access and acceptance, UFCW local unions in California, Pennsylvania, Michigan, Illinois, Iowa, Colorado, and Washington have all hosted vaccination sites to serve many of the brave essential workers that our union represents. And while our last survey of essential workers showed that over 70% are ready to take the vaccine today, some still have some very sincere questions. Today, Dr. Fauci will be answering questions from several of these essential workers across the country about the vaccine and COVID-19. To start our questions, though, Doctor, what's the public safety implication in the Texas and Mississippi decisions to lift the mask mandates, both to the general public and to our essential workers?
I think that was ill-advised, Mr. Perrone. It is really quite risky to do that for the simple reason that if you look at the amount of infection that there is in the community right now, even though the slope is coming down sharply, if you look at the last 7-day average, it's done this. That's a dangerous sign, because that has happened in the past, when you pull back on measures of public health, invariably you've seen a surge back up. So we really don't want to claim premature victory. Right now, we need to get the level of community spread. Right now, it's between 55 and 70,000 cases per day. In order to completely pull back on all public health measures, you want that level to be remarkably low, very, very low. And 60 to 70,000 per day is not low. So I think that is really risky to pull back on mitigation measures of public health.
Would you recommend that our members continue to wear their masks?
Absolutely. And I've been saying that all along. I have been saying that. Dr. Rochelle Walensky, the director of the CDC, has been saying that. And the president of the United States has been saying that. Remember, he has said even before he became president that he wanted to have 100 days of wearing masks, and maybe even beyond, but at least 100 days from the time of his inauguration.
Okay, well, next I want to go to one of our members, Dr. Fauci. This is a question that comes from Latoya from Ohio. Latoya?
Hello, my
Hi,
name is
Latoya.
Latoya Mathis, and on behalf of the workers at CVS and Madeira, located in Cincinnati, Ohio, we would like to know what are the side effects of the COVID-19 vaccination. Thank you.
Okay, so the side effects of the Moderna and the Pfizer are twofold, because it's a prime and a boost. So most of the time, and I could speak for myself because I got the Moderna one, you get an injection, and maybe several hours after the injection, You get a bit of an ache in your arm. It isn't really overly painful, but it can bother you a bit. It did me. I didn't feel very comfortable. I went to bed that night, woke up the next morning. It was there for about another 10 hours, and then it disappeared. When I got the boost, it was a little bit different. What happened with the boost is I got vaccinated 28 days after the first prime. I got the second vaccination. I felt the same sort of transient ache in the arm, but then about maybe 8 or 9 or 10 hours into the day, I started to feel fatigue, just sort of washed out. I felt a little chilly. I remember because my wife had a shirt on and I was in the kitchen with a sweater and a jacket, and I still felt a little bit chilly. I felt a little bit achy. I went to bed that night, woke up the next morning, still felt a little fatigued. By the time I got into that afternoon and evening, I was back to normal. So you can expect after the second dose to feel temporary, transient feeling like a little bit of a flu-like syndrome. Now, there can be variability, Mr. Perrone. There may be some that feel a little bit worse or for a little bit longer, and there may be some who get no effect at all. But that's the general average, what you see. Now, with the J&J, it's only one dose. So with the J&J, if you happen to get the J&J, you don't get that situation with the second shot where you can feel that chill. It's usually just a little bit of an ache of an arm and maybe just a little bit feeling uncomfortable for a few hours.
In addition to talking about the side effects, what else could you tell somebody that might alleviate some of their fears about taking the vaccine?
Well, if you look at the serious adverse events, they're extraordinarily rare. And sometimes when you see adverse events, it has nothing to do with the vaccine. In general, as with most vaccines that are approved by the FDA, this has gotten an emergency use authorization. They are generally, in the long term, really quite safe. And the risk, as you mentioned yourself, with so many of your union members, unfortunately, getting seriously ill, some dying, some who get infected and have duration of symptoms, prolonged symptoms, even after they so-called recover, the risk of COVID and the deleterious consequences of COVID are clearly more than the risk of having a really serious adverse event with the vaccine.
Well, our next question comes from Kathleen from California.
Hi, Dr. Fauci.
Hi.
My name is Kathleen Scott. I'm a grocery worker here in Los Angeles at Albertsons. With the recent spike in COVID outbreaks in grocery stores over the last 2 months, leaders need to prioritize getting us this vaccine as soon as possible. My question is this. Once I get the vaccination, do I have to worry about bringing this virus home to my family who aren't vaccinated? Thank you.
What we are recommending right now, since the end point of the vaccine that proved the 94 to 95% efficacy for Moderna and Pfizer, was protecting you against clinically recognizable disease. We don't know yet what the effect is on your possibly getting infected, but because you're vaccinated, you get no symptoms, that you might have virus in your nasopharynx. And even though you really feel well, you could inadvertently pass it on to someone else. So when you're dealing with someone who is not vaccinated and you are, that's why we recommend you still wear a mask. Now, in the next couple of months, we're going to be collecting enough data that will allow us to say whether or not that virus in the nasopharynx is transmissible or not, because it might be at such a low titer that you wouldn't have to wear a mask. But for now, it's recommended you wear a mask to protect the other people that you might come into contact with.
You know, Dr. Fauci, you heard from Kathleen that a lot of our members are very much concerned about bringing this virus home to their loved ones. Have vaccine trials started for children? And if they have, when can we expect children to be able to get the vaccine?
Well, vaccine trials have started for children at various ages. We usually do what's called an age de-escalation. You start with someone like 12 to 9, 9 to 6, 6 to 2, and 6 months to 2 years. Right now, we project that the clinical trials will give us information that by the time we get to the fall, that high school students will be able to be vaccinated. I'm not sure it's going to be the first day of school, but sometime in the fall. The way the program is now scheduled, children who are elementary school, 6 to 12, that group of individuals, or 5 to 13 or 6 to 12, those individuals likely will not be able to get vaccinated until their trials are finished, which will likely be at the earliest the end of this year, at more likely the first quarter of 2022. Excuse me.
Well, our next member question comes from Gannon from Indiana.
Hi, my name is Gannon Small from New Albany, Indiana. My question for you, Dr. Fauci, is not about the vaccine, but advice for the essential working people. What advice do you have for us who can't properly maintain social distance from those who don't wear a mask, like those of us in retail and food service industry? Thank you for your time.
Well, the thing that I could recommend is probably something that you are doing. Make sure you keep your mask on at all times. Wash your hands as often as you possibly can. But you're absolutely right. Sometimes you're in a job that beyond your control, you can't always maintain that physical distance. To the extent that you might be able to manipulate the spacing in the place that you work, try as best as possible to keep as far away as you can. You know, I've been in some food stores where they have a shield and they have a long counter and you put in and you get it there, but not every store can do that. So that's the reason why you've got to try your best with what you have, but always wear the mask, keep it on all the time, particularly when you're dealing with people who are in the store.
Dr. Fauci, do we know the durability of the 3 vaccines and whether or not we're going to need to vaccinate 70% of the population each year to stay protected from this virus as we move forward in the future? Have studies begun to check the durability of the vaccines?
Yes, durability is determined by just following people for a period of time to see how long the protection lasts, to see how long the level of antibodies lasts. Right now, we know it lasts at least 6 months. It might be 8, it might be 10, it might be a year and a half. We don't know. We're going to be following them carefully, and hopefully it will be longer than that. It will be enough that we don't have to keep coming back. But if we do, we'll be prepared for it, and we'll be making vaccine to be able to give a boost. But we don't know the absolute accurate answer to your question.
But we do know it's at least 6 months at this point, correct?
Yeah, right now, if you look at people who have been vaccinated and continue to be followed, remember the vaccine trial in phase 3 started in July 27th. The vaccine in phase 1 started right in March sometime, I believe.
And they're going to follow that control group for quite some time to be
2 years, 2 years.
Right. So before we end, let me thank you again, Dr. Fauci, for your time and your service to this country during this pandemic. We appreciate you taking time to answer these important questions from some of our many brave essential workers in grocery stores and meat packing plants who are helping keep Americans fed during this crisis. And I want to thank you for doing all that you can to ensure that essential workers in Americas have vaccine access as soon as possible. Thank you so much, sir.
Good to be with you. Thank you for having me. Good luck.
Good luck. Thank you. Bye-bye.